So welcome to this talk. We're talking to Dr. Susan Oliver, who you'll probably recognise from various previous videos. I've completely forgotten where you are, Susan. Is it Australia somewhere?
I am in Australia, John. I'm actually in Sydney, Australia, and I'm speaking to you from lockdown in Sydney, Australia.
Oh dear. So when did this happen?
Well, all of Sydney has went into lockdown at 6 o'clock tonight, so it's Saturday night at the moment. But I live in a more high-risk area, so I've been in lockdown for about 24 hours longer than that.
Right. So it's gone from a patchy lockdown in different parts of the city, and it's now the whole city, is it?
That's correct, yeah. And it's actually what they refer to as Greater Sydney. So that's Sydney metropolitan area and a few other metropolitan areas that are kind of joined on. So it's all up about 6 million people. So,
right. Wow.
And it also just very inconveniently has just coincided with the start of the school holidays. So the school holidays started today. And that means a lot of people in Sydney are going to be spending the next 2 weeks at home with their children because they can't go anywhere.
Are you allowed to take Julie for walks?
Absolutely, yes.
So you can do that?
I can do that. So they call it lockdown, but I think they call it 4 reasons you can leave home. So one is to get exercise, and that can obviously outdoors. You can do that with up to 10 people. You've got to be distanced from them, but you can do that 24 hours a day if you really wanted to. The other reasons to leave home are to buy essential items. That's unfortunately I wasn't quick enough. If I could just have a little prompt here. Toilet paper. This is how much toilet paper I now have to last me for 2 weeks. Because although I can still go to the shops to buy it, there actually is none left in the shops. So every time we announce a lockdown in Australia anywhere, all the toilet paper just disappears. But you can leave home, even though, so why, I don't know, because you're still allowed to leave home for essential shopping. You can also leave home to work if you have a job that can't be done from home. And although if some places, like if you worked in a dress shop, well, your dress shop's going to be closed anyway, so you can't do that. And then the other reason to leave home is to get any sort of medical attention, which includes getting a vaccine and also getting for COVID.
Yes, of course, yeah. What's the reason for this lockdown, Susan?
That is because of the Delta variant, and it started 10 days ago, and a limousine driver tested positive on that day. He was working transporting international flight crew to quarantine hotels. People who are working that position are supposed to be vaccinated, are supposed to wear masks, are supposed to get tested every day. He did none of those things. He was unvaccinated, unmasked, and he did get tested, which is when it was picked up, but it wasn't a daily test. And so by the time it was picked up, he'd already spread it to quite a number of people. So in the last 10 days, there's been 82 cases, which probably, like I know in the UK you're thinking, yeah, but it is accelerating. So 29 of those 82 cases were actually in the last 24 hours. So you can see sort of like it's accelerating quite a bit, although that 29 was actually from 55,000 tests. So it's still obviously quite low. But the reason they've had to go into lockdown is because basically the contact tracers, by the time they've been finding people, and they have managed to link all the cases, but by the time they've found positive cases, they've already been in the community spreading it for a few days, and so they haven't actually been isolated. So it's just spreading really quickly, and they tried to just do a partial lockdown, and like I said, and they only made that decision yesterday. And at that stage, the majority of the spreading had all occurred in these few suburbs, but today they found out, nope, it's spreading in other areas, so they've just locked down the whole city.
So who's the least popular guy in Sydney at the moment?
Yes, that would be the limo driver, and probably closely followed by whoever wrote the health orders, because it's turned out, because the police have been investigating, but because of some crazy loophole, they can't actually prosecute him. and that's because he was working for a private company and not the government. And because of that, the way the health orders were written, even though he should have been following it, he wasn't legally obliged to follow it. That's now been changed, but too late. And now anyone who does breach those orders, it's 6 months jail and $11,000 fine. So,
right. So there's been a lack of governance here. I mean, you know, the odd driver being a bit rogue, you can kind of expect, but you would expect organisational structures to supervise your loose cannons, really, wouldn't you?
Yes, and that has been happening. So the majority of people in the quarantine, working in the quarantine system, are actually employed by the government. So in that case, it's very strict. They really wouldn't get away with it. But there's a few private companies in there, like this company, which was basically a limousine hire company, and they weren't enforcing it. They will be, but it's unfortunately because the way the health orders were written, it didn't specifically refer to them or something. Apparently, he won't be prosecuted. And he's of course, this is quite sort of amusing. He's denying that he's even the cause of it, or he thinks that actually it's just a total coincidence that he happened to be transporting. You still see me, or just Julie? He thinks it's a total coincidence that he actually caught it from just someone else in the community. It's just a total coincidence that he's the only possible person who could have trusted, because we do the genomic sequencing, and that means we know it didn't come from a regular traveller in hotel quarantine because it doesn't match them. But with the international flight crew, they basically fly in, stay for 24 hours and then fly out again. So we don't necessarily, we do test them, do like a rapid test when they first arrive, but if they then leave, they can turn positive and we won't capture it because they basically left the country. So we're pretty sure it's come from an international flight crew. We even know what plane they were on. They were from the US, so Delta variant is clearly in the US. But we can't absolutely prove that that's where it came from. So his story that really it was just some other random person, I mean, it's clearly not true, but we can't prove that it's not true, you know.
Well, I think that attitude and that belief illustrates why there is a problem, because he simply doesn't understand what's going on. In the United States, Delta variant is over 20% now, and probably doubling every 10 days, perhaps as much as 10 days, maybe 2 weeks at most. And it is going to become the predominant variant in the States. So this has got quite significant travel implications, really. It's like Europe, the variant came from India to the UK, and now the UK, from the UK, it's spreading on around Europe. And but one thing you said does slightly concern me there, the outdoor activity. Now, in the past, we've always thought outdoor activity was essentially safe. You probably remember that, but there was quite a lot of demonstrations last summer in the United States, and we thought, oh dear, these could be mass spreader events. But it turned out they weren't, because they were outdoors. But the transmissibility was less. And since then, we've had the 40% more transmissible Alpha variant, and another 60% on that is the Delta variant, which I believe is 124% now more transmissible. So I'm just hoping that people with this outdoor regulation realise how transmissible this Delta variant is. I mean, do you think that awareness is there in Australia? Are the authorities publicising how transmissible this is?
Absolutely. And in fact, one of the things that they bring up again and again, and one of the advantages of, well, there's lots of advantages of not having the virus in your country, but a key advantage is we can really follow every single case and work out exactly where transmission occurred. Now, one of the transmissions they were basically able to capture on CCTV, it was 10 seconds. They basically saw these two people cross paths quite close to each other, like, probably about 30 centimetres from each other, for 10 seconds. And that's all it took for the transmission to occur. So yes, we definitely know there has been one case which just appeared to be outdoor transmission, but they're not sure. And that was someone who was sitting outside in a cafe. The person walked past them, but because there was no CCTV there, it could have actually happened. They could have both happened to have gone inside at the same time and paid or something. So they're not 100% sure that actually occurred outside. But we do know, like, say, 10 seconds. The other key thing that we're noticing is it used to be previously sort of if one person became infected in a household, about 30 to 40% would also become infected. It's 100%. So it's, there's no question that it's more transmissible. There's also, we've had one, what we're calling a super spreading event. That was a birthday party. One infected person went to the party. At that stage, they were asymptomatic, no idea they were infected. There were 30 people at the party. So far, 20 of them have tested positive. The ones that haven't are vaccinated. So whether they will eventually or whether they'll be lucky, it's hard to say.
That really is quite concerning. I mean, this is the reason the virus took hold in the UK, because people were coming back from India, often in multi-generational households. And as you say, every time, as far as I'm aware, every time the entire household has got it. And of course, some members of the household were going out to work. So that's another really important message that, you know, initially we said if someone's sick, put them in a room upstairs, shut the door and open the window. And that was enough to prevent transmission. That doesn't seem to be the case now. And the other one that's concerning is that there was some Danish football fans went to a football game outside. And I think 5 of them have tested positive for Delta variant. And it's been essentially confirmed that they caught it at a football match. But we are dealing with a whole different level of transmissibility here. Absolutely. So what's the genomic sequencing like in Australia? Is they sequencing everyone or a few people that come back positive? Or?
Absolutely 100%. So every single positive case, they do genomic sequencing on it. So so that's how we know that every single person is connected to this, you know, patient 0. We know there's not like a second seeding event. And that's how, like in Melbourne, they did end up with some Delta strains down there. They straight away knew through genomic sequencing, which, by the way, really sorry for the people in Melbourne, but one of the people at the birthday party flew up from Melbourne to attend the birthday party, and he did bring it back to Melbourne. I think they've probably gone to, he's only spread it to one person who's a co-worker. Hopefully they've got everyone else down in Melbourne locked down, so it's not also going to start spreading in Melbourne. There was also someone who flew to New Zealand. Julie's going to start making noise.
That's fun.
Just playing with them. She's getting restless.
Dogs are great.
So someone flew to New Zealand as well who was infected. So luckily, at this stage, there hasn't been any spread in New Zealand. I think they picked up they were a positive case when they got back to Australia. So they were only in New Zealand for a few days. They tested positive in Australia, but whether or not they were infectious in New Zealand is not clear. I mean, New Zealand obviously taking precautions, but at this moment in time, they haven't actually had any spread in New Zealand. I mean, I think
yeah. So, sorry, go on, Susan.
I was just going to say, needless to say, New Zealand's now closed their borders. And as has, of course, the rest of Australia, and certainly can't blame them for that. It's like.
Right. So all the Australian states are now closed off. So you can't travel from New South Wales to Victoria, or
no. It slightly varies by state. So basically, I mean, if you live in Sydney, you can't travel out of Sydney anyway. So because that's the Sydney.
Yeah, sure. Yeah.
But some states have closed the border with the whole of New South Wales, and some have just closed it to the Greater Sydney area. So at this stage, there's no cases outside of Sydney, but they have detected the virus in the sewage in a town called Burke, which is, and people in Australia would know a saying called the back of Burke, which basically Burke's a long, long way away. It's 8 hours drive from Sydney. So they've detected it in the sewage there. They haven't actually found any positive cases. But I mean, there's Burke, the population of Burke's about 2,000, so they'll probably just test the whole population and find out if it's there. But that's the only, at the moment, that's the only hint of spread outside of Sydney. And that may not be an active case because, as you know, you often shed virus, weeks and weeks after you've been infectious. So we often have like these detections in sewage that don't actually correspond to an active case. They just happen to be, someone who's still shedding. So, but New South Wales has also put restrictions on the rest of New South Wales. So outside of Sydney, you still have to wear masks anywhere indoors, basically, besides where you live. There's no Julie's got a ball stuck under a bit of furniture and she's barking at it. There's no what we call vertical consumption, which means if you go, so you can still go to restaurants or bars, but you must be seated. So there's no walking around and intermingling with a lot of people, no dancing, no singing, and they reduce the capacity limits to like 50% pretty much in.
Yeah, but indoors the Delta variant will be transmitted in those circumstances.
That is correct. But at this stage, the virus actually isn't in these areas. So it's sort of like a proportional response. If a case turns up in any of those areas, they'll follow Sydney and go into lockdown as well. So, but this is like a proportional response to if it does get there, to mitigate how far it's going to go. And obviously, if you're a vulnerable person, stay away. Like I said to my parents last night, which was before Sydney was in lockdown, and where they live, they're sort of bit outskirts of Sydney. They weren't in lockdown, but I said to them, "You're in lockdown." I said, "You're not going anywhere besides your local shop, you know," and that's it. And
so you basically put them into guarding, in other words. Yeah. That's
right. Yeah.
Is Burke locked down then at the moment, Susan?
No, and that's because although they've detected it in the sewage, they haven't actually detected any cases. So, and look, Burke has a population of about 2,000. It's a little country town, so there's not the chance you have like in the city of like huge, massive spread.
Yeah. I think the thing let's just do a bit of geography first of all. For those outside Australia, Sydney's New South Wales, isn't it?
That's correct. Yeah. So Sydney's the capital of New South Wales. Yes.
Yeah, and Melbourne is Victoria.
That's correct. Yes.
Yeah. So I think the thing in favour of Australia at the moment is it looks like this is largely a single focus. So part of the reason the Delta variant took off in the UK is there was 2,000 people arrived from India in the first 3 weeks of April, and we had multiple seeding events.
Yes.
Whereas it sounds like the authorities are more or less on top of this. So that's incredible. Do get Julie. Don't worry about it. Go and pick up Osman. She's fine.
There's a problem when you go live, isn't it?
Oh yeah. It's what it's all about.
Just stop and say, okay, we'll start again. It's only 5 minutes.
No. This is live, folks. This is all live. So anyway, that single focus idea. I mean, as far as we know, there's no Delta variant community transmission in Sydney at the moment. Cases that have just popped up randomly, as far as we know.
That's pretty much it. Yes. So out of the 82 cases that I mentioned, 80 of them have been directly linked. So they know they've come from and they've all been genomically linked. So we know they've all come from the same index case, because as you know, with genomic sequencing, it's not just about the variant. You can also tell who it's come from, because of, every time someone gets infected, there's a tiny bit of mutation. So we do know that all these cases are linked to this one person. So yes, we know that absolutely. Of course, Australia could soon possibly be fighting on another front, and this news only came through today, and they've detected a case in a man who works, I think it's in a gold mine. Now they already worked out where he's caught it from, which is really quite tragic in a way, because he's so in a lot of the gold mines in Australia, they have what they call fly in, fly out.
Yeah, FIFO.
FIFO, yeah. So he'd been out, and he'd actually been in Victoria, and this was at the time of the virus cases in Victoria. He hadn't actually been anywhere near any cases. He was actually in regional Victoria. But because of the rules in Brisbane, when he got to Brisbane, they put him into hotel quarantine. He's caught the virus in hotel quarantine, and then he's flown to the mine. I think he's somehow been. I think they worked out there'd been some spread in this hotel.
Yeah.
They then contacted him, and so he's now gone into, and then he's tested positive. He wasn't symptomatic, so he had no idea he had the virus. But there's basically 900 people who work in that mine with him, and because it's fly in, fly out, they're all over Australia. So we're holding our breath. Basically, it could be fine. They've identified the really close people, and they're testing them now. We could be lucky. But if not, those people have literally come from every state in Australia and they've been in contact with him and are there. So, you know, it's early days. I mean, one of the things we don't know at this stage, because it's very new, we haven't got the genomic sequencing yet. So we don't know whether it's Delta or whether it's something else. We're assuming the worst, saying, yep, let's treat it like it is Delta. But we will find out whether it is or not. Like there are a few little cases in Brisbane at the moment too, but they're alpha and they're very well contained. It was someone who was another hotel quarantine case that has spread. But in that case, it was like literally 2 hours after they got out of hotel quarantine, they worked it out. So they spread it to a couple of people, but very, very well contained. And I don't think anything's going to happen with that one. But
wouldn't it be ironic if hotel quarantine turned out to be the cause of a major outbreak in Australia?
I know. Well, I mean, in a way, most of the major outbreaks do come from hotel quarantine. I mean, the one in Sydney actually hasn't, but
the others have, yeah.
There's no virus normally circulating in Sydney, so everything essentially is coming in from inside. And we are actually they are looking at doing special quarantine things instead of using hotels. They're actually building purpose-built ones. There's already one in Darwin. There's been one approved for Melbourne. I mean, they're not going to be ready till the end of the year. I mean, I just think they need to start acting like hotel quarantine isn't perfect.
Yes, I mean, these hotels are designed as hotels.
Yes.
So the airflow system may go from room to room or from corridor to room, and
it's more. They tend not to go from room to room. They're thinking it's more when it's happening. And the case in Brisbane, that was nothing to do with airflow at all. This was actually spread from a healthcare worker. So they basically taken a swab off one person and then gone to another floor, taken a swab off that person for the testing, and somehow they've managed to transmit the virus. So this obviously they haven't done something right, and you know, so and I think that's the problem. So people, like at the moment, people are saying, okay, let's stop hotel quarantine, let's have these purpose-built things, and then the problem will be over. It's like, it's not going to be over. You've just got to start acting like it's a really contagious virus and assuming that everyone in hotel quarantine has accidentally caught it. And maybe it's something as simple as, okay, after you get out of hotel quarantine, you're still under some restrictions for the next week. You've got to wear a mask everywhere you go. You've got to have daily testing, you know, rapid saliva test. Like, I think they need to just start acting like people in hotel quarantine are contagious. Like, stop. It's been proven again and again it's not a perfect system. So start acting like it's not a perfect system instead of going, oh no. And like everyone has, we should stop it and we should do this instead, this and that. And like, yeah, all those things will help, but there's no silver bullet. You've just got to start, this is my opinion, you know, you've just got to start doing things smarter and just assuming that your system hasn't worked.
But it's working a lot better than the UK, that's for sure.
Well, that's right. Like at the end of the day, I think although we've had and it definitely seems like the outbreaks seem to be accelerating, and that's obviously a result of the fact more infectious. I mean, it started with the alpha, and it's just that now the virus we were dealing with a year ago is not the virus we're dealing with now. And
correct.
But, you know, vaccinations are happening slowly.
Do Australians realise they are on borrowed time?
I think when things like this happen, they do, but generally not. And even now, so the way this particular outbreak has happened is they've sort of been escalating the controls. So the first thing they did was just mandatory mask wearing, which it started off, I think it started on public transport. They then extended to all indoor public venues, and then they went to all indoor venues outside of residential, you know, residential. So, sorry, my mask here, it matches, it's upside down. So as you know, John, this is how you wear a mask. Right?
Cool.
This is how, I don't know, 20% of people wear their mask.
You know, that annoys the heck out of me.
Yeah, it gets worse.
I want to say, just don't bother. In fact, sometimes I would say don't bother. You know, just do it properly or don't bother.
But at least the people who are doing that, they're probably just maybe genuinely ignorant. You then get people. Yeah, you then get people doing this. Now that is not doing anything, right? Or this. And those people are, and you just see it all the time, those people are just having a laugh. They're basically doing it because there's a fine. If you get caught, $200 fine, which is not that much, but basically if the police come on the bus, pull up the mask. That's just so unfortunately, no, people aren't taking it seriously. And there's still people, I haven't been anywhere where masks are required today because I'm trying to stay away from places like that. But I did go grocery shopping. Yes, was it yesterday? Yeah, it was yesterday. Foolishly, before I found out that we were about to go into lockdown, so I didn't stock up on toilet paper. But I saw, say 80% of people were wearing masks. Well, that's nowhere near the 100% that should have been, And so no, people, and we were in one of the what's called a 7 high risk council areas. So that's not even, people in outskirts of Sydney who hadn't been told that they're under risk. So this is in like a risky area, and people just aren't bothering. So no, people don't understand. Interestingly, one of the places that the virus has got into is Parliament House. So we've got half of the government is actually in isolation at the moment. They're all confined. So we have a difference between lockdown. So what me and the rest of Sydney in is lockdown, which is, you can't leave home for certain reasons. Isolation means you're a potential contact of a positive case. Isolation means isolation. So you're either, and they'll either be done in your own home if you can do it in your own home, or you'll be put into hotel quarantine. So if you're in a situation that you're sharing a house with other people who haven't been exposed, so you then have to move to a totally separate premises. And I mean, the government will pay for that, so you don't have to pay for it.
And that's being actively managed by contact tracing teams.
Absolutely. But there's thousands of people who are in that situation. But anyway, one of the people who was recently tested positive is actually a politician. And he's a minister in the government, I think an agricultural minister. But I just saw him on the news just before we started. And the first interview I saw him, he was sort of saying he'd sort of tested positive. He said, oh, yeah, I'm feeling fine. Well, I saw him again today. He is so sick. He was just sort of like, he just only used to say, I feel terrible, I never thought it could be this bad. Now, I should explain, he's under 40, so he wasn't eligible to be vaccinated. So he's not someone who didn't get vaccinated when he could have. He's not eligible. But he is now a contact of all these other politicians. So this is probably a good thing for a lot of people, is that most politicians can't leave their homes at the moment. Yeah. And that's both sides of politics. So it doesn't matter whether you're political or not, who you like. There's sort of quite a large majority of politicians are confined to home.
The virus doesn't care, but it's quite sobering that a relatively young man there has become quite ill. Yeah. So what is the
Sorry. Yeah.
Yeah, I was going to say, what is the vaccine sort of situation now in Australia? How's it going?
Well, there's good news and bad news. We're up to, I've just got this number written down here, 7,527,605. That's the total number of vaccines administered. Most of those will be first doses, but we are getting to second doses on some. And the way we're doing it in Australia is AstraZeneca is being rolled out with a 12-week gap. And that's because from the trials, they showed that was the most efficacious if you had that 12-week gap, whereas the Pfizer's been rolled out with a 3-week gap. So the reason that there's a lot of people who are only had their first dose is because of that gap, although AstraZeneca people are now becoming eligible for their second dose. But my second dose isn't due till the 17th of August, for instance. My parents' is next month. So there's a lot of people who've had their first dose but not their second dose. But I mean, in terms of how it's taking off, so the first 1 million doses took 47 days, whereas the last 1 million only took 9 days. So the pace is definitely increasing. And although 7 million or 7.5 million is many, it's 28% of over 16s. Over 50% of over 50s and over 67% of over 70s. So in the higher risk groups, we've got a higher proportion, but that over 70s, like anyone in that group has been able to get it for months and months. So there's no logistical reason why that couldn't be 100%. And even in nursing homes, so in nursing homes, there's sort of been a team has sort of gone into every nursing home and vaccinated everyone who wants to be vaccinated. I think it's about 85%. So it's still, even there, not everyone's taken up. And some of the reasons for not taking it up, I mean, I nearly cried when I heard it, because there's some people saying, well, it doesn't matter if I die. And I just thought, oh, that's just terrible that people think that, who are living in nursing homes. I don't know. I think there's probably a lot of undiagnosed depression and stuff, or I don't know.
Yes. I think depression is greatly underdiagnosed in older people. I think that's absolutely true. Yeah. But for you personally, it must be very frustrating. You've got to wait for another. I mean, it seems weeks ago since you had your first dose now, and
it was. I think I'm about a month past my first dose.
Yeah.
I definitely haven't had the rare side effects. But what's happened now is, because of the side effects, and sadly, there's now been 2 people who have died in Australia from the blood clots, which is, I mean, too many. The second person who died was a lady who was 52. And following on from that, they've now upped the age for AstraZeneca again to now it's now over 60. So it's now only people over 60 are getting the AstraZeneca. If you've had your first dose, you get your second dose, and that's because we know that, you know, in these rare events really tend to occur after the first dose. So if you've been okay after the first dose, you're going to be okay after the second dose. But that, of course, is throwing things into chaos. But it also means that the people who were holding out are going to be fully vaccinated before I am, because they'll be getting the Pfizer dose at the 3-week interval. That being said, I personally, like, you know, it's circulating now. I've had my first dose, which I think the last figure I saw for that was 71% protection against serious disease.
Oh yes, but only about 33% protection against infection.
Against symptomatic, but do you really care if you get a mild cold?
No,
not really.
Of course
but
not. No.
If you get serious disease. So 71% against serious disease is not bad, and particularly when, I mean, I'm a very young 56, so I'm not a really high risk group, obviously. I mean, I'm most concerned for my parents. Like, they're still like a month away, and like, if I could give them my dose, you know, I would gladly do it.
Of course.
But,
it's strange, isn't it? If the rare side effects, if they're going to occur after the AstraZeneca, it's usually after the first dose, and after the Pfizer, it's usually after the second dose, isn't it? It's
yes, and it just exactly. It's really strange. By the way, on that Pfizer, the myocarditis and everything, which we're not really seeing in Australia yet, and that's just because no one who's going to get it is really is eligible for Pfizer yet. So it's not something. I think there's been 1 or 2 cases that have occurred, but at the moment the incidence in Australia is no higher than what you'd expect just generally in the population. That doesn't mean it'll stay like that, because obviously, like I said, it's over 40s are the only people who are eligible at the moment, unless you're in a specific occupation or whatever. But I read something interesting the other day that I never realised, that you actually get the same side effect after the smallpox vaccination, which obviously no one gets anymore, but I had mine. I
didn't know that. That's interesting.
Yeah, I didn't know it either until I read it. I thought, oh, that's interesting. And I mean, I think, and it's amazing that they picked it up then, because I think obviously back in the days when they were giving the smallpox vaccinations, the pharmacovigilance was not what it is today. I mean, that they're sort of not too far off, you know, the thalidomide sort of time. So if
any young people are watching this video, go onto Google, type in smallpox, and have a look at the pictures of people suffering from smallpox. It is the most wretched disease. You know, just look at those pictures and just be grateful that this disease has been eradicated everywhere in the world except some biological labs around the place. We believe. Well, we know for sure we've got some important down in the UK. So I suspect, shall we say, other countries have got stocks as well, but there's none in the wild since 1977, I think it was. But do have a look at those pictures, the people with smallpox. It's just awful, just awful. Do have a look at that and be grateful it's not there anymore. So anyway, so basically we're on a bit of tenterhooks at the moment in Australia. We need to watch the next few days really carefully. So pleased to see that the surveillance is good, the test and trace is good. I mean, compared to the UK or the United States, of course, Australia is way up there in the stratosphere for excellence. But I get the impression this is largely due to governance in Australia rather than individual compliance. So I think we really have to appeal for individual compliance in Australia, that people wear the mask properly and follow all the rules, because I guess people in Australia just don't. Maybe they realise academically, but a lot of people don't realise how this has just devastated lives in other countries.
No, because even now, like I said, we had the number now is 29 cases overnight, but that was out of 55,000 tests. So it is still, most people still think, and they're right, it's not going to happen to them. That could change. It's changing now. I do have confidence that we will get on top of it like we have every time. But the lockdown, they've already said it's going to be for 2 weeks. So
yes, I agree. I think this one's containable. The one from the gold mine, we have to wait and see. Doesn't alter the fact Australia's on borrowed time, and it really should be a real motivation for. I mean, I know the government's flat out on the vaccine program, but hopefully getting every individual flat out on it as well.
At this stage, the plan is still to have all Australians who want to be vaccinated by the end of the year.
Yeah,
and that's because, and we'll be getting, obviously, the whole AstraZeneca thing has sort of thrown everything into chaos, but the Pfizer vaccines are really ramping up. We've also got some Moderna coming as well, I think maybe hitting the shores in about September. And we're also going to be using potentially the Moderna vaccine for booster shots.
Yes, that looks like that's going to be quite feasible. Yeah. And they're making the Oxford AstraZeneca now in Melbourne, I think, aren't they?
That is correct, yes. And obviously we're not going to be using all of the vaccines we're making, but they'll all be given away to our neighbours, essentially. I mean, we're already doing that now, but we'll be giving away way more. So I think the plan was to make about 50,000 doses in Melbourne. We'll still make that whole 50,000, and what we don't use will just go to firstly to all the countries in our region who don't have the money to buy vaccines themselves, and if they don't need them all, they'll just go into the COVAX scheme.
Yeah, a lot of people don't realise just how much aid and benefits and education and things goes from Australia to places like Papua New Guinea and the Oceanic Islands. Australia is a bit of an unsung hero, really, in terms of humanitarian aid for these places, and people very often simply don't know about it. So I would expect Australia is going to be quite pivotal in vaccinating quite a few of those areas.
Absolutely, yeah.
Yeah. Great, Susan. That's fantastic. It's great to talk to you as always. Anything else you want to say? Are we happy?
Well, there is
any other pressing news? The magnetism. Yeah, go.
Yeah. So after my last demonstration, that there were a couple of people who were sceptical because of my demonstration showing that I wasn't magnetic, and they thought because I was using a stainless steel spoon.
Well, when you say a couple, I think we mean a couple of hundred, really, Susan. But yeah, carry on.
Yeah, there were. Yeah, I'm not quite sure. I'm not quite sure how many of the comments I read, but there were quite a few comments saying, "Oh, that stupid Australian scored an own goal. Stainless steel isn't magnetic." Duh. Well, here's the spoon. This is a spoon I used last time. Here's a magnet. Probably won't stick this time. It's quite funny. It is magnetic. The people are right. It is, and also there were other few people who were saying, "Oh, it's because I didn't do it in the injection site." Yeah, no, it didn't stick to that. Basically, there's different grades of stainless steel. Majority of them are actually magnetic. There is a couple of grades that aren't, and they actually have a completely different chemical structure. So it's not actually related to the amount of iron in the stainless steel. It's just that they have a different chemical structure, which means that what causes a magnetism doesn't happen anymore. But pretty much cutlery is always made out of the magnetic form. So that's just what.
I'm convinced, and Susan is a proper scientist. She is the real McCoy. So I'm accepting that explanation 100%. Susan, that's great. Thank you as always. Now, just a quick trailer. Me and Susan have got a slight deal going on here. We're going to talk about her scientific life in another video. So keep an eye out for that. We'll be talking about Susan's work in nanomedicine. And given that I haven't got a clue what nanomedicine is, I'm personally looking forward to that. So that'll be out sometime soon. So keep an eye out for that. Susan, wonderful to talk to you. Thank you for that update from Australia, and stay safe for the next 2 weeks.
Thank you, John, and you too.
Thank you.